In this video, you will learn from an internationally recognized leader in the field of conservative dental implantology, who has transformed the lives of thousands of patients and educated hundreds of dentists through his seminars, webinars, and online training programs. Introducing the father of keyhole implant dentistry, Dr. Joseph Shomelian.
Hello and welcome to this webinar. My name is Dr. Joseph Shomelian. We're going to be talking about modern methods for the replacement of missing or extracted teeth. Now, before I actually even get onto this topic, let me just say that I would encourage each one of you to avoid the need for extractions. If you can try to avoid losing your teeth, in fact, get a second opinion if a dentist recommends the removal of a tooth or a number of your teeth, it will save you having to have a variety of treatments that we're going to discuss in a moment. Realistically, why are teeth removed? And sometimes it's inevitable or unavoidable. You can't help the fact that teeth have loosened, weakened, or decayed beyond repair. But at other times, dentists make a decision, a rash decision, a quick decision to remove a tooth rather than try to save it, or rather than to offer you the treatments available to save it. But if you have lost your teeth and you're wearing a partial denture and you really don't like the idea of wearing those things, or you just are dissatisfied with the idea of so many other options that have been given to you, today I'm going to reveal to you the best modern method in non-removable tooth replacement possible. It's called keyhole implant dentistry. But before we get on to describing what that is, let me run through a couple of very important basics. But first, you need to know who I am. My name is Dr. Joseph Shomelian. I'm a dental surgeon from the University of Sydney, graduated in 1978. And I've been an implant dentist for over 30 years now, since 1984. And it's with tremendous amounts of experience that I can offer you the solutions that we have that have evolved over the last 30-40 year period, with confidence that we can achieve a painless, excellent outcome for you. So much so that I founded and I am the president of the Australasian Society for Conservative Implant Dentistry, a society that teaches practitioners and the community about methods of replacing the teeth without surgical intervention. I am the senior dentist at a practice in Chatswood in Sydney called Chatswood Dental, and I'm a fellow of the International Congress of Oral Implantologists and the fellow of the World Congress of Microdentistry. It's because of my love of conservative dentistry and implant replacements of missing teeth that I've formed the association that I've just mentioned, the Australasian Society for Conservative Implant Dentistry. Now, in that role, I conduct lectures and seminars for dentists, and these are pictures of some of the attendees who are now certified members of the association, and you'll find out more about them later on. But I've conducted seminars for the 3M Corporation, which has a large dental department dealing with dental materials and dental implants for the replacement of missing teeth. I've conducted seminars in small groups and coached practitioners in the field of replacing missing teeth using these technologies. But my most enjoyable activity is that of helping patients one-on-one, being able to assist them to get rid of their dentures and enjoy a much better quality of life than they may have had to date. Now, please make a note of these little contact numbers here. If you wish to contact the society, and in fact, you'll be contacting me directly as well too, through these numbers on 1300 966 663. That's 1300 966 663, or email your inquiry to ascidinquiry@gmail.com. Now, I'll keep that slide up just for another 10-15 seconds so that you can make a note of that. If you need pen and paper, well, maybe this is the time to just step out and get that, and I'll give you another, say, 10-15 seconds to make a note of that. 1300 966 663 or ascidinquiry@gmail.com. You'll be given these numbers a bit later on as well too, so don't fret if you haven't been able to mark them down yet. Now, let's talk about keyhole implant dentistry, the most painless, affordable, and desirable method to replace your missing teeth. Now, we want to replace your missing teeth with non-removable porcelain crown and bridge work, but without damage to adjacent teeth, without cutting the gums, without stitches, without pain and swelling, without a lengthy healing period, without high cost, with proven high success rates of 96% over a 10-year period. All of these are desirable elements of the treatment that you need to consider. You don't want to have situations where practitioners advise you to have treatments which involve, as I mentioned, damage to adjacent teeth or cutting the gums or stitches, painful pain or swelling during or after treatments, without lengthy healing periods and without the excessive costs that can be involved sometimes, and sometimes with worrisome success rates. So I've drawn this little flowchart for you here. To replace missing teeth, you have a number of different options, but I've used color coding, red here and green as well, just like in traffic lights. With traffic lights, red indicates treatments that are no longer really desirable. Green indicates the pathway you should go with to replace your missing teeth in a positive manner. So let's go through this. We have removable techniques which involve acrylic dentures or chrome dentures, removable dentures. The other techniques which are non-removable include bridge work or surgical implants. These two suffer with a number of negative elements, which I'll describe later on, but the non-removable option that is most ideal nowadays is the keyhole implant technique of using small diameter implants, or what we call mini implants. Let's go through these one by one. Now, a removable acrylic partial denture is very unnatural. The dentures sit on the gums and the teeth don't fit in the gums. They cover much of the palate and may damage your adjacent teeth with time. You can see this large plastic plate which sits on the palate and covers it to a great degree. They are subject to breakage, and sometimes they can break at the most inopportune times, of course. They can strip the gum from the teeth over a period of time, and often these dentures are called gum strippers. They are retained by unsightly wire clasps, as you can see here, or in these images. In this image you can see here, not the most appealing aesthetics at all. Here's an image of a lower denture, a partial denture, and you can see the unsightly clasps there. It's because of these factors that we consider these to be old-fashioned and unnecessary. In fact, we may use them for a temporary purpose only, but not as a permanent replacement of your missing teeth. The second option in terms of a removable denture is that of a chrome partial denture. Chrome partial dentures, again, are removable, are natural in their construction, and that, of course, they sit on the gum and the teeth are not placed in the gum. They cover less of the palate, but they again may damage adjacent teeth with time, and they are subject to breakage and retained by unsightly wire clasps. You can see the wire clasps here and here. Although they're in the back, sometimes when they're in the front, as these are, they can be unsightly. But again, they are better. If you choose dentures, these are better than the acrylic dentures. They last a lot more effectively, and are far less damaging. Again, there are better options. Now, with regard to non-removable porcelain bridges, non-removable teeth, you can have porcelain bridges which are permanently attached to your teeth, but they do require damage or reshaping of the adjacent teeth. Have a look at this diagram here. You can see how the natural teeth here and here will be acting as supports for this three-tooth bridge, which would be cemented on top of these little reshaped teeth and cemented into position. Now, these sort of bridges are all well and good, but they do require permanent damage to the adjacent teeth. Sometimes the nerves can die in those teeth, or you can get secondary decay underneath the bridge, resulting in the loss of one or other or both teeth, and hence you then end up with a bigger gap. 3 teeth missing rather than just the one that's missing there. So that too is not something we can really consider in this day and age. It's not possible if the gap is too big. Let's say, for example, you don't have that back tooth, or you've got that one missing as well too. For example, in this case, here's a large number of teeth missing, and there are no supports that can effectively carry the bridge. They're also not possible if there is no back tooth. Take a look at this particular case. The patient has a number of teeth missing, in fact 9 missing teeth, only a few remaining teeth here, but there's nothing to attach a bridge to. So how can one create a bridge in that situation? The answer is not possible at all. In cases like that, traditionally over the last 30 years, we've used conventional surgical implants, which are wide diameter titanium screws two components, the section that is placed in the bone, in the gum, and the section that sits above the gum. So let's have a look at some of the elements associated with these sort of implants. To place these implants, the gum needs to be cut open. The healthy bone structure of the jaw is removed, and the gum is stitched back after the operation is performed. They do require up to 6 months of healing. They are complex in their componentry, as you can see. They're very precisely engineered structures. They need to fit into each other, locking in, and there's a screw that runs from this component called the abutment through into the main implant, through this hole connecting to that screw thread that you can see there. Accordingly, they are costly. The fees can range from $5,000 to $10,000 per tooth. I will go into a little bit more information in a moment as to why there's such a variation. It's basically because of the need to do what's known as bone grafting, and I'll describe that shortly. But however, the final result is achieved 6 to 7 months after surgery. So when you look at this cross-sectional diagram, you can see the bone here, the jawbone, and the implant is placed in that site. The implant abutment, which is this element here, can be either a titanium or a gold structure, can also be a white porcelain as well too, and the crown is then fitted on top of that, cemented into position to achieve a lovely result. That's the final result you're looking at there. Implant and the crown, the same manner as a natural tooth, with a natural root and the natural crown of the tooth. Because of the complexity of these elements that I've measured here, of these points here, we really don't think that's necessary in this day and age. Have a look at what's involved with this conventional surgical implant. Surgical placement of the implant requires incision. The gum must be cut open. Precise drilling of the jawbone to create an implant site of around 4 to 5 millimeters in diameter and up to 18 millimeters in depth prior to implant insertion. If the cavity is not drilled precisely to the right dimensions, your implant will fail. It will be too loose and the bone won't grow onto the surface, a process known as osseointegration. We wait 6 months for the damage that's been caused to heal and for the bone to fuse with the titanium surface, as I mentioned, a process known as osseointegration. The wound needs to be sutured or stitched back up again, and it takes 4 to 6 months for total healing. You can see how the drill is used to create a precise depth and precise width of bone structure. That is carried out not with one drill, but a series of drills, a narrow, a wider and wider and wider series of drills until the right depth and right diameter is achieved. There's one very important issue. Drilling down deep into the lower jaw is a concern because underneath the bone structure is a little channel which carries 2 blood vessels, an artery, a vein, and the main nerve that supplies sensation to your lip. That's what we call the neurovascular bundle there. If it's damaged, if the drill penetrates too deeply and damages that structure, you lose sensation to your lip temporarily or even permanently. So it's very important that when what we call the osteotomy site, the actual area that is drilled out for the implant, is performed, that the nerve structure that travels underneath and sends branches to these natural roots is not damaged. Now, this is a key element of concern in the use of surgical implants, and I'm going to show you how keyhole implants completely avoid this concern. So there we are again. There's the implant site, but once the gum is stitched up, it takes 6 months for the area to heal, as I mentioned. After 6 months, the gum must be cut open again to access the hollow center of the implant, into which these abutments must be then placed inside and screwed through the center of the implant to hold the abutment in place, after which the screw-retained abutments can act as the foundation for the crowns. These porcelain crowns can be cemented on top and you have your final result. However, we have a problem in that occasionally the screw that runs between the abutment and the implant can loosen and cause a slight wobbling of these porcelain teeth. Anyway, that's a very rare occurrence, but it is something to keep in mind. Now, a conventional surgical implant often requires additional bone grafts. Let's have a look at this. This is a cross-sectional diagram of a tooth sitting in the jaw. When the tooth is extracted, the bone starts to shrink. So here we are with the tooth in place, there we are with the tooth being extracted, and you can see immediately upon loss of the tooth, that the area over a period of 6 months will start to reshape, resorb, and you end up with a narrower bone structure here. That narrow bone structure cannot accommodate these wide diameter implants. Accordingly, in order to create a wide foundation for these implants, a bone graft is carried out. Now, if you look at here, these are two little screws that are holding this rectangular block of bone. And of course, one has to ask, where did that bone come from? That bone is taken from the chin or the back of the jaw, or sometimes the rib or even the hip, or other undesirable surgery, just in order to create a sufficient bone to accommodate a wide implant. So that is one of the reasons why I do not recommend this type of implant any longer. I performed this sort of implant treatment for over 25 years, and I have to say that there is no need to do this any longer. Here's another diagram that depicts this very clearly. You can see the loss of bone here, the filling in of that area of the bone graft in order to accommodate that diameter implant. You can imagine that implant cannot fit into this narrow space ordinarily. Now, I'm going to show you a little slide here. It is a surgical image. It's of the donor site in the chin where the bone graft is taken. You can see how the gum needs to be cut open all the way there, exposing the chin itself. Then a window of bone is cut out of the jawbone, and that bone is then positioned in the surgical site, the receptor site, and this too is a graphic surgical image. So please don't get upset, or if you'd rather not look at it, don't close your eyes for a moment. This is the horrendous amount of gum tissue that needs to be opened up in order to reveal the jawbone, and then that block of bone taken from the chin is screwed into place, left there for 6 months to become part of the jawbone before one can even go on to placing the implants and then building a new tooth on that. Rather dramatic, don't you agree? I really don't like the idea of having that sort of thing done to myself, nor to my family, and I don't recommend that you go through that either if you don't need to. Because in reality, a non-surgical keyhole implant in the form of these titanium narrow diameter implants does the job just as well, we've found over the last 10 years. So let's recap. A conventional surgical implant requires surgery, requires removal of healthy jawbone. It requires 4 to 5 millimeters of width and 18 millimeters up to 18 millimeters of depth to be removed from your healthy jaw. Requires up to 6 months of healing. Requires complex componentry. Often requires additional bone grafts, and the fee range can be up to $10,000 if bone grafts are required, and the final result takes 6 months to achieve. Whereas a non-surgical keyhole implant here, there's no surgery required. It's minimally invasive into the jawbones. We only drill in 1 or 2 millimeters in diameter and 4 to 6 millimeters in depth. Hardly any invasion of the jaw at all, and gives you an immediate result. Simpler componentry, no bone grafts are needed, and we have very high success rates. And because of the simplicity of this treatment, the fee is a much, much less than if you were to have a conventional surgical implant. So accordingly, let's say goodbye to that technique, and let's talk in detail about keyhole implant dentistry. So what is keyhole implant dentistry? Have a look at this. That tiny little entry point there, which measures up to 2 millimeters in diameter, is all we need. Just a tiny little space into which we can place the tip of our implant, and as that is inserted into the gum, the bone structure actually expands, and there is no need for the removal of healthy bone. The bone structure expands to accommodate these implants beautifully. And here we are with a diagram, an image of 3 implants having been placed in an area where there's no tooth behind there, otherwise a bridge could have been contemplated. With 3 little implants there, there we are with the 3 implants being inserted, and a bridge of 3 natural teeth, 3 porcelain teeth I should say, cemented on top of those little connections there, about 2 weeks after the insertion of those implants. There is no incision, as you can see. There's no bleeding, there's no stitches, and the permanent teeth are attached just a few weeks later. It's brilliant. It only takes about 2 to 3 hours in total to do that treatment, and it's virtually painless. So much better than what we used to do. Now, don't take my word for it. This is an international authority, Dr. Gordon Christensen, from the US. He wrote in a paper recently that the mini implant has arrived. He said more patients have been served successfully at reduced costs with minimized pain and trauma, patients who could not have been treated with implants otherwise. What we're saying there is that patients sometimes are unable to have bone grafts. They may not be able to afford the treatment. They may not be medically suitable to have these sort of treatments, and accordingly they've been given dentures or other options which are not as ideal as having these mini implants or the keyhole implants. Now, a recent analysis of over an 11-year period of nearly 5,500 or over 5,500 implants was carried out in New York by Dr. Todd Shatkin, and his results showed that for teeth that are not removable in the upper jaw, we have about a 96% success rate, and in the lower jaw the same thing. Over an 11-year period, that's 96% of implants that were placed were still functioning over a 10 or 11-year period. That's superb. Even fillings don't last that well. So 96% of the time, when we place these mini implants, patients have a wonderful outcome. Let's have a look at what this gentleman says about his experience having had surgical implants placed previously, and years later having had the simpler keyhole implant procedure performed.
I've just had my second implant. Now what's interesting about it is last time I was in a lot of pain, a lot of anguish for the whole thing, but this time it was a situation where I came in, I was taken care of, everything was fantastic, and next time I remember waking up at home. But more importantly, with this implant, there was absolutely no pain at any point in time, not even a discomfort when I got home. So it was absolutely fantastic. I've just had the tooth placed in. I'm really happy. Believe me, for a guy who's absolutely panicking about coming to a dentist, it was a great experience.
Let's go through a few examples now of the type of treatments that are very common. Replacing a front tooth, which ordinarily would have been taken care of with a chrome partial denture. Instead, we're going to use a keyhole implant and a porcelain crown. I wonder how many of you who are listening on this webinar actually have this problem of a single tooth, one single tooth missing, and a large lump of either plastic or metal in the roof of your mouth or in your lower jaw to carry that single tooth. Here's a simple option. There's the implant in place with a little core built around it, and there it is in the x-ray, and then the porcelain tooth placed on top of that within just a short couple of weeks. Treatment time is around 90 minutes from start to finish, and the best part is it can be performed virtually painlessly. Now, this young man had this sort of treatment a number of years back, and let's have a listen to what he says about his experience.
So when I was 17, I had an orthodontist who made a gap wider because I was naturally born without a tooth. I then had a implant put in, which was screwed in. It wasn't particularly painful. So that was 7 years ago when I was 17. I'm now 24 and I've had no problems with it.
Replacing a side tooth is a very common procedure. Often people are missing the first or second premolar, and it's a bit unsightly when you smile at the corner of the mouth to have the gap showing. So the placement of an implant is very straightforward here. You can see how there's space, and the implant has been placed in painlessly. There is no blood, there is no stitching, there's no incision, and accordingly very little, if any, discomfort at all. Treatment time has taken about an hour, total treatment time, and there's the lovely porcelain tooth. It looks as though it's actually growing out of the gum. You wouldn't be able to tell the difference with that nor that. Natural tooth, implanted tooth, natural tooth, implanted porcelain tooth. Brilliant technology. This lady had that procedure performed on each side, one on the right, one on the left side, and let's have a listen to her testimonial as well.
I came to see Dr. Shamilian in July last year. I had a baby tooth, no permanent tooth. I bit into an olive, the tooth was loose, and of course it fell out. I hated my plate and popped in and came and had the 2 permanent implants. The best thing I've ever done in my life. I expected it to be uncomfortable, didn't even feel it. In fact, I almost fell asleep while it was being done. A week later I came and had the permanent one attached, and as I say, it's just the best thing. So anyone who's got a plate, there's no option except to come and have a permanent implant.
One of the very first cases that I performed, in fact the first case that I performed using this technology, was the replacement of a large upper partial denture. Let me show you how large this denture is. It goes from here around to there. very large, 9 teeth on this denture, complete coverage of the palate, and only 3 natural teeth supporting it. It covered the palate completely, which of course meant that the patient lost all sensation of warmth and the coldness of food when food touches the palate, as well as being relatively unstable in that there's only one clasp there sitting on a back tooth, which meant this denture would flip and drop relatively easily. There we are. You can see the clip at the back, the clasp around that one single molar, and that entire structure resting or pivoting around that one little wire retainer. A very unstable method of replacing the teeth. So without the denture, of course, there we are with lots of teeth missing. But as soon as we performed keyhole implant dentistry with 9 implants in the gum, we were able to create a 9-tooth non-removable bridge with nothing in the roof of the mouth, nothing covering the roof. So that was a beautiful way to help this wonderful lady, and let's have a listen to what she says about her experience.
In 2003, I was wearing an upper denture, which I did not like. I came to Dr. Shamilian, who said that I could have these mini implants on which to put proper teeth. I did so. It was totally non-invasive, and I've never looked back since.
Here we are. This is the X-ray of the particular treatment performed for her. In 2003, you can see the 1, 2, 3, 4, 5, 6, 7, 8, 9 implants in the upper jaw. And remember, she said it was non-invasive. That's quite remarkable, isn't it? To have had that many penetrations through the gum, and she said it was painless and non-invasive. Here we are 8 years later. The implants are in place, and this is the bridge work in place. You can see the upper bridge and the lower bridge as well too. This is a bridge that was in place with traditional wired implants from 25 years earlier. Another wonderful treatment that we can perform using these implants is to stabilize loose dentures, whether they be lower full dentures or upper dentures. The concept is that of placing 4 supports, 4 pylons in the lower jaw, and the little ball on the end of each implant allows an O-ring to clip over the top, which is seated within this metal housing, and the combination of the two are seated in the denture itself. The denture clips onto the implants and gives a very solid retention and complete stability. When patients have flat lower jaws, in other words, the ridge is resorbed so much that one cannot have a stable denture, we can place 4 of these implants painlessly, and inside the denture we can put 4 of these precision attachments, metal housings with the rubber O-rings that clip over the implants and create a beautiful result. In the upper jaw, we need to have 6 of these implants because of the softness, the softer bone structure that is present in that environment. So we'll need to spread the load a little bit more by having 6 implants rather than 4. The wonderful thing about this treatment is that we get rid of the need to cover the palate. The palate is left uncovered, and therefore the textures of foods, the temperature of food can be enjoyed much more. Here we are. You can see the 6 implants in the upper jaw, and once again there are no incisions, no stitching, no bleeding. If we had to do this with conventional implants, the incision would run from there all the way around, cutting the jaw open. It's a dreadful treatment. We just don't want to even think about it. This is so refined, so elegant, and so kind to our patients. That's why I recommend keyhole implant dentistry for all of my patients who have missing teeth. Let's have a listen to what this gentleman said about his treatment with dentures that were connected to these keyhole implants.
I found the teeth extremely good. They've been solid in my mouth. I'm able to eat a meal. I've been able to taste my food, which is very important as far as I'm concerned. But no, I've never been happy with my teeth. I've had problems with teeth most of my life, and I've had plates, etc. But this is something I'm really, really pleased with, and I'm extremely happy that I've done it.
To finish off, let's have a listen to what this lady had to say. Many of you may have similar experiences, similar thoughts, and I encourage you to sincerely consider keyhole implant dentistry as the best option to help you, just like we did for this lady.
Hi. After years of horrific dental experiences and putting up with a lower metal partial denture for years, which I hated, I did a lot of research on the internet, went to see 3 other implant specialists. First ones told me I couldn't have implants, others said I needed bone grafts, and it was all getting so expensive and so hard. I was even going to go to Thailand. I was even, sent over some x-rays over to Thailand. I was getting pretty desperate. And then I came here and saw Dr. Shamalian, and he did a lot of checking and said yes, I could have these mini diameter implants. And of course I asked a lot of questions because some dentists said no, some said yes, and after he fully explained everything to me and the minimal procedure that would be needed, I thought, wow, this is what I've been looking for. And sorry, a bit teary because he was so good. And anyway, I agreed to have it done, and the cost was going to be a lot better than what I expected, and to be able to have this done in a couple of weeks without travelling to and from Thailand and things like that, and stitches, well, this is great. Anyway, I came here yesterday, very nervous, wondering what to expect, and it was really, really good. There was just a very small amount of pain, nothing that was any worse than what I'd had with any other dental experiences. I went home, to the motel, had a good night's sleep, and came back this morning where he completed the other side, and I'm just very pleased I came here. About 4 weeks ago I had the implants put in, and just temporary ones, temporary teeth over to get me going for a couple of weeks till the real teeth, to replace them with permanent teeth. Had no problem with that. And now it's been around 2 weeks since I've had the permanent teeth in, and everything's going great. I found with Christmas Day I could eat everything, cashews, everything, not worrying. I didn't have to run off and clean them. I've had no problems whatsoever, and it just feels really good to get rid of a denture. And there's no pain, and everything feels natural. I'm just back here today for a little bit of fixing up and to make sure I've been cleaning them okay, and so far so good.